Picture this: a loved one suddenly shows signs of a stroke, and emergency services are on their way. In those critical moments, every piece of information you can provide is a vital clue for the medical team. Knowing what details truly help can make all the difference in getting the right care, right when it is needed most. It is about equipping those first responders with the full picture to act swiftly and accurately. When a stroke is suspected, any recent injuries absolutely matter and should be shared with emergency medical services. This includes falls, bumps to the head, or any unexplained bruises or physical trauma, especially those occurring in the days or even weeks leading up to the onset of stroke symptoms. Providing this information quickly helps paramedics and doctors understand the full context of the situation, guiding their immediate actions and diagnostic choices. The reason recent injuries are so important is twofold. First, an injury might be the cause of a stroke. For example, a fall or trauma, particularly to the head or neck, can sometimes lead to a dissection in a blood vessel, which is a tear in the artery wall. This can then cause a blood clot to form and travel to the brain, resulting in a stroke. Second, an injury, especially a fall, might be a symptom of a stroke that has already occurred. Someone experiencing sudden weakness, dizziness, or a balance problem due to a stroke might fall as a direct consequence, and the fall itself is then a sign that something is wrong neurologically. Paramedics need to differentiate between these scenarios to provide appropriate care and begin proper investigations. To help emergency medical services effectively, try to recall the timing, nature, and severity of any recent injuries. Was it a hard fall directly onto the head, or a stumble with a minor bruise? Did the person complain of neck pain after a sudden movement, or were there any signs of disorientation before the injury occurred? Even if an injury seems unrelated at first, mentioning it allows the medical team to consider all possibilities. Your accurate observations are incredibly valuable in helping them piece together the puzzle and make informed decisions about treatment pathways. An often overlooked but critical detail is the use of blood thinners. If the person who might be having a stroke is taking anticoagulant medication, even a seemingly minor head bump can become a major concern due to the increased risk of bleeding in the brain. This is why paramedics will ask about medications and any recent falls, as a combination of blood thinners and head trauma can elevate the urgency and alter the diagnostic approach, potentially requiring immediate imaging like a CT scan of the head. This specific interplay can significantly impact the speed and type of medical intervention. Sharing information about recent injuries empowers medical professionals to understand potential causes, identify if the injury is a symptom of an underlying stroke, and consider factors like blood thinners. By providing these details, you help ensure that the person receives the most appropriate and timely care, optimizing their chances for a better outcome. Your quick thinking and clear communication are key in these urgent situations, helping to guide the medical team toward the best course of action.